I have to give myself a shot, and this is a perfect time to show you guys how to give a subcutaneous shot from a nurse of 16 years. Before you start, if it is a refrigerated medication, take it out of the fridge and leave it at room temperature for about 30 minutes before you give it. It makes the injection a little more comfortable, but in some cases, the medication is a little more effective when it is brought down to room temperature. Next, we're gonna grab our supplies, which will be your medication, and if that med needs to be diluted into something, you're gonna have the diluent ready. You'll grab a sub-Q syringe, and if you're using alcohol swabs, have those ready too. Next, you're gonna wash your hands really, really well and choose a site to administer the injection. For subcutaneous injection, that medication is going to be administered into the fat tissue between your skin and the muscle. The best place to find that layer of fat tissue will be the back of the arms or the lower abdominal tissue, the anterior or front of the thighs or buttocks. Just make sure there's no bruising, no damage, no inflammation. You need to be rotating these sites, not just giving it in the same site every time, because something called induration can happen where your body builds up thickening and scar tissue. It'll be hardened and uncomfortable. That it also will make the medication less effective because we're not going to be getting to that fat tissue where it's absorbed. You want to be rotating these sites, rotating to different quadrants and areas of your abdomen, rotating different sites in your arm and rotating the arms. Then we're going to cleanse the area. Pinch about 2 inches of that layer of fat, only pinching the fat tissue, not so deep that we're squeezing the muscle into it. And if you're like me, there's no risk of me finding the muscle on this area of my body. Then we uncap, go in at about a 45-degree or 90-degree angle. I do not find that darting it really fast is helpful. Hurts more. I think there's more of a chance of missing when you dart really fast and poking yourself. I like to pinch the skin, slide it in like butter. I'm not gonna go really slow. Hold it like a pencil or a dart. I like to have the finger that will be pressing the plunger out and ready. So I pinch that area. I'm going to go in. Now I press it and pull it out. From there, we have something called a hot needle. I have used this. If this were to stick somebody else, they have now made contact with my blood product. So we want to be responsible with this. Some medications have safety measures where you can continue to press the plunger and a safety guard will come up over it. Others do not. You can lay the needle cap on a surface and slide it into the cap gently. And discard your used needle in a sharps container, maybe a coffee can or some other can with a lid. I hope this helps, and follow for more.